Namaskar, good afternoon, ladies and gentlemen. This is Rahul Koul, Chief Editor, BioVoice News, your host and moderator for today's e-conference. And it's my pleasure to welcome to today's esteemed distinguished guests to this e-conference on India's roadmap to digital healthcare, challenges and opportunities, organized by BioVoice News, India's leading digital news media platform for providing news and insights on the life sciences industry. Ladies and gentlemen, the idea behind this event is to bring forth fresh perspectives on the current digital healthcare scenario in India. So today's e-conference is a part of exclusive series of virtual events focused on transforming the life sciences sector in India. So as often witnessed in the times of adversity, the COVID-19 pandemic has inspired promising innovations, particularly in the digital healthcare models. Survey conducted by Boston Consulting Group recently across doctors and patients, it gave findings that 85% of the clinicians use digital platforms for patient interactions during the lockdown. And almost 60% of the patients, across metros and tier 1 cities reported that they would continue using digital platforms for primary care in the post-COVID world, due to the fundamental benefits of shorter waiting time and easy access to qualified doctors. So, therefore, we are witnessing a sudden acceleration of digital technologies across value chains within the healthcare sector. So today's discussion will focus on the key points such as decoding digital healthcare, what is the definition of the digital healthcare, who are the stakeholders, and what is the scope. Also, lessons from COVID-19, how has the pandemic accelerated digital adoption, use of digital technology to strengthen patient-doctor relationship, electronic medical record, relevance of digital in hospital settings, and policy push and regulatory framework for fast-tracking digital. Also, one of the important discussion points will be that patient data protection, how prepared we are to deal with mammoth data built up. And finally, last but not least, it will be preparing the digitally skilled workforce of future. So, ladies and gentlemen, we have a distinguished panel lineup for today's session, and we hope that you thoroughly enjoy the fruitful discussion today. So, on this high note, let me first introduce my esteemed panelists for today's e-conference. I'd like to extend my warm greetings and welcome to Mr. Ajay Sharma, co-founder, COO, and operations head of Desh Clinics, and industry veteran with 32 plus years of experience. Mr. Ajay Sharma has provided his professional expertise to companies across various functions. After a stint of 25 years in corporate, Mr. Sharma became a serial entrepreneur and has multiple startups in his kitty. So currently, he's spearheading Desh Clinic, also known as digitally enabled smart health clinics. Desh is using digital technology to connect leading specialists from Delhi, Mumbai, and Bangalore with its clinics across rural India. Welcome, Mr. Sharma. Next, I would like to introduce Dr. Raja Indana, Medical Director, MFine, physician and diabetologist with over 15 plus years of experience. Dr. Raja Indana's expertise lies in treating conditions related to infectious diseases, diabetes, hypertension, and thyroid disorders. Dr. Raja is particularly passionate about doing research on lifestyle diseases, and developing a deeper understanding of artificial intelligence in digital health. Greetings and welcome, Dr. Raja. Warm greetings to our next panelist, Enbasekar D, who's popularly known as Enba. He's the co-founder and Chief Technology Officer, MediBuddy. As the CTO of MediBuddy, Mr. Enbasekar ensures that app brings better usability of its products and does exceptional delivery of healthcare services. With varied experience and expertise in the healthcare sector, ENBA has worked extensively in R&D of medical software, medical devices, as well as developing cutting-edge technologies for healthcare industry. For his contributions, ENBA has been featured in the Forbes 30 Under 30 list in 2017 and 18. Welcome, Mr. Enbasekar. Last but not the least, my warmest welcome to Mr. Himanshu Sikka, Project Director, SAMRIDH Healthcare Blended Finance Facility. With over 16 years of experience, Himanshu is a development planner by qualification and has worked with several international agencies, including the World Bank, DFID, USAID, UNICEF, WHO, and the Global Fund, to name a few. He brings with him the experience of working at the grassroots levels to support national and provisional governments in developing policies and large-scale programs. He currently serves as a project director of USAID-funded PAHAL project and is also strategic advisor for the SAMRIDH project. Welcome again, Mr. Sikka. And I would also like to once again welcome all the delegates who are here to listen to us today, and also our reputed panelists, as I look forward to their insights. Today's discussion format shall be 3 rounds with a total time duration of approximately 75 minutes. Each panelist will be allocated a total 18 minutes of time for 3 rounds. That means 6 minutes of time for each round. So before we begin this discussion, my humble request to the delegates is that they should share their queries only in the Q&A window. And if the time permits, our esteemed panelists shall try and reply to their queries by the end of the session. So without much ado, I'd like to begin the first round with 6 minutes of time for each speaker. So ladies and gentlemen, when we talk about digital healthcare, we as a layman, imagine a mobile phone or a laptop being used to communicate, our healthcare related issues to doctors. So there are different perspectives about what exactly the digital healthcare is, and what exactly it means, because it's a niche area and it's an upcoming area. So how do we define digital healthcare, and who are the stakeholders, and what is the broader scope of digital healthcare? I would request Mr. Ajay Sharma to enlighten us with his insightful views. Over to you, sir.
Thank you, Rahul, and thank you, BioVoice, for bringing us together. I think it's a very simple thing if I go with the word itself, digital and the healthcare. We are trying to use the digital medium to provide the healthcare services to the needy people. And it is not limited to just creating an app for the teleconsultation. It is much deeper in that. During the COVID, when people were going through the CT scan and there was a huge rush of going for consultation, there are companies those who created the AI which can actually understand the CT scan itself. There are telepathology which is going on nowadays. People are working on that. There are sensing systems which are required for remote patient monitoring, which is part of the digital healthcare. And the most important part is we are generating so much of data now because of being digital. Then how do we use that data? So the health analytics becomes important, keeping the data becomes important, privacy of the people become important. So there are many things which comes under the digital healthcare system. When we started using the digital healthcare for the rural areas, we specifically focus only on the rural side. We found that just having an app itself is not good enough, because the doctor doesn't understand what the patient is saying and the patient doesn't understand what doctor is recommending. So we added another layer in that, we call it assisted teleconsultation. That there has to be somebody in between who actually help the patient and the doctor communicate with each other. So digitally, when we say that we have a digital platform, that is not just limited to creating an app for teleconsultation. I think that's the beginning of the system. The rest of the things become more and more important. Now let me come to the the diagnostic side of it. Since we are operating at the distant level, rural level, it is very difficult to even provide the diagnostic services to the people or the lab services, the pathology side. Now we have been exploring that what are the alternate methods which are available. Now I'm happy to see that there are companies who are developing non-invasive diagnostics thing. Now that's a part of the digital revolution which is bringing that you don't have to always go into the traditional method of identifying the problems of the pathogens. There are better ways which are coming in. To me, the digital is growing. To me, for the India country like India, or maybe the other countries where we have the population which is not served, or rather underserved population from the medical side, digital healthcare is a boom. It is not just a facility. It is a necessity that we need to have the digital healthcare in countries like us. This is what I wanted to share.
Thank you, Mr. Sharma. And I would like to now go to Dr. Raja Indana. The question remains same. What is the scope, your understanding and the scope of the digital healthcare?
Yeah, thank you for the invitation. Thank you, Mr. Rahul. So I come from the medical background completely. Being a doctor, been practicing for about 15 years and started my journey with MFine 5 years ago. That's when digital health was in a very nascent stage. I would say it was only about convenience or consultation at that point of time. So then we started working on it and how to set certain triaging priorities, how to take history of patient. So triaging has become a very important thing because see in digital health, it's not just the convenience. Can we guide the patient in a direction so that can this be handled digitally or the patient needs to go to a hospital? At least telling that at the need of hour has become a very important thing in our point of view, from the doctor's point of view, because ultimately we want to care for the patient. So we said that, okay, there should be a proper triaging. So that added a layer towards care. So what we thought is this, first we started with convenience. There should be convenience for the patient and the doctor. So there is a digital medium where they both can interact, understand the problem and come to an appropriate solution. That is the first thing. The second thing we thought, how do we bring care in this part, not just convenience? How, and then after a couple of years, can we influence the outcomes? Can this digital revolution or digital health tech that is happening, can this bring better outcomes for patients? So we added a layer of it. How did we do that? I would say that in this process, more digital acceptance, like let's say devices you would have seen like Apple Watches, Fitbits, so many of these are collecting a lot of vitals. Can we use these vitals to predict data, to predict any event that is happening and guide them so that we are able to deliver better outcomes? So convenience is handled by creating a medium to interact. Can we create this transformation, collect the data and guide so that you can prevent long-term complications? Can we bring in better health outcomes? Let's say diabetes, hypertension, pregnancy, child growth, all this, there is a lot of data that is coming in. Can we influence better pregnancy outcomes, better lifestyle diseases outcomes, better milestone tracking in pediatrics? So all this. So I think digital health is providing that medium. What I would say is this, earlier when digital health was not there, the point of care was more at the hospital. Now the point of care is coming to where the point of need is, where the patient is. It is coming to their home. For simple things, primary healthcare, patient need not travel all the way to the hospital. Let's say, I would say Mr. Ajay was telling about Desh Clinics, how doctor is taken to rural areas with the help of assistive intelligence, not just an assisted care. So taking it to rural areas, bringing that specialist so that these patients need not rush to tier 1 or tier 2 cities for specialist doctors. All this digital transformation from convenience to outcomes to care as center, we see a great transformation and great future for digital health. Yeah.
Thank you, Dr. Raja, for your initial thoughts. I'd like to now next go to Mr. Enbasekar. The question again remains the same, that what is your understanding of digital healthcare, and what is the kind of scope you think it has in the future?
Sure, sure. In technology product, whenever we talk about scope, we more often talk about what it is not, rather as much as what it is. So I would quickly maybe add a couple of points that I think on what digital healthcare or digital ecosystems or solutions for healthcare is probably not, so that to keep that misconceptions away. In my opinion, definitely digital healthcare is not necessarily a replacement to what is a current existing healthcare ecosystem. It's definitely a add-on. It definitely is emerging as a very key component of the healthcare journey of any patient. But across different lives, the journey of a patient through the healthcare ecosystem, it is going to become a key component, but definitely not a replacement for what is, if I can say so, non-digital or the conventional healthcare. And second, it's definitely not a substitute for the clinical knowledge, not a substitute for the human understanding, the empathy that a medical professional would bring to healthcare, be it a doctor, be it a nurse, be it a professional, be it a lab technician, and so on. So digital, while will assist, improve manifold times a lot of these processes, and make it easier for healthcare professionals to deliver healthcare. Definitely, in my opinion, it is not a substitute for the human touch needed in healthcare. So those two I wanted to call out as out of or at least that's what it is not in the digital healthcare definition.
Thank you, Dr. Enbasekar. A very balanced thought, I would say. And now next I come to Mr. Himanshu Sikka. So, sir, what is your understanding of digital healthcare concept, and what do you think the kind of scope it has got in the future?
Yeah, thanks a lot, Rahul, and to BioVoice for having us here today. A lot has already been said, but like digital health, to me, it is much beyond what we normally perceive it to. Normally, even people think a WhatsApp call constitutes digital health, but it goes much more beyond that to things like even remote robotic surgeries in traditional setups using any kind of e-health based technology. All that constitutes digital health. So the basic perception over the last few years, especially in the COVID times, has been that anything that's patient focused and where the technology is taking it, the doctor to the patient, constitutes digital health. But that's broadly, if you look at the overall infrastructure, it's not the case. Digital health is very much there also within your brick and mortar facilities, be it your digital X-ray machines, your CT scan machines, all of that constitutes digital health. If you go by the definition of digital health, anything which uses technology in any manner or information communication in any manner constitutes digital health. It has been used a lot in the last few years when it comes to in form of mobile health or through e-pharmacies and all, which is taking the care outside of the traditional setup of the hospital towards the where the beneficiary or the patient is, whether it's at their home or at a primary healthcare clinic. But if you were to look at the overall kind of space, it is quite wide, as I said, and that's where we kind of need to focus on as well, because unless or until we are looking at the integration of digital health across that spectrum, from point of care devices or mobile health applications to e-pharmacies to how our secondary and tertiary facilities work and how they use technology within their operations, whether it's through their hospital management information systems or the technology devices that they're using, their tech-based devices that they're using there. Everything has to be seen in a kind of a overall landscape of digital health, and that's where I kind of differ from the normal definition of digital healthcare that we use. And if we start looking at that kind of a spectrum, then the stakeholders are also very valid, and the scope of digital health kind of becomes much wider than a narrow definition. So yeah, that's probably my thought there is.
So thank you for your initial thoughts. Now I'll move to the second very important point. We have recently, gone through the COVID crisis, and we have seen how, lockdowns have affected our daily lives, and tremendous pressure on our professional lives as well. So digital healthcare played a very important role during this period, and we have seen how it has also sort of accelerated adoption of digital healthcare. So my next question would be related to this: that how has COVID-19 accelerated digital adoption, and what are the lessons from COVID-19 which we can implement in the future? So I'll again start with Mr. Ajay Sharma. Over to you, sir, for your insights.
I think the first very important thing which happened was that it got legitimatized. In the March 2020, when the order came that, now it is treated as a proper way of, providing the consultation and the treatment. So that's a major change. And I think hats off to the government officials who were proactive enough, or maybe reactive, but, very, very fast enough to bring that, change in the law. So that was a major thing. I don't know, I was not in the digital healthcare before that, so I don't know what problems, the industry faced when they were doing the teleconsultation without the law supporting them. There are other things, which we found during the pandemic was that, people thought that, teleconsultation is using the WhatsApp call and just talking and, taking the giving the consultation or providing the prescription. Then the proper system started, then this law brought that, there has to be a proper doctor, which means the doctor's qualification, etc. is tracked. So it is not that anybody can do that. The second was the prescription has to be there, which means that it is not just sending the name of the medicine over the WhatsApp is going to be accepted. It has to be proper prescription. And when it came to prescription, which means doctor has to be serious enough to look at the diagnosis, write proper things there, so that patient is taken care of there. Third thing which I think people have started realizing, and which Dr. Raja also said, that we now realize that not for every disease we need to go to the doctor or to the hospital. So there are certain things which can be actually managed over the phone, and in case if it is required, then you go to the doctor in person, or maybe now that has democratized the whole system, which means that doctors are now available from X place to Y place, and you can avail the services without any hitch. It's a very open platform. There are places, which never thought that, they can avail the best of the doctors from best of the hospitals, now able to do that. So that change has happened, and people have accepted this as the way of getting the treatment. I think that's the basic, thing which has changed. Yes, there are a lot of things, which needs to be improved upon. Data is, again, I'm bringing the data because, that is one area where we are not that good at from the platform point of view. But these are some of the lessons, which we learned, and the changes which happened during the COVID period or after the COVID.
And thank you for your thoughts, Mr. Sharma. And having more and more access to internet and mobile phones, has it also helped in sort of, deeper penetration of the digital, clinics like yours? So because you are working at the grassroots level, you are taking
Yes.
digital healthcare to the rural areas. So,
Yeah.
So how is internet, accessibility in the rural areas helping it towards the digital, towards the better penetration?
I think this Digital India mission, which the government of India started, long time back, maybe they did not envisage that there will be COVID kind of stuff which will come. But yes, thanks to the technology and the broadband structure, which has been now penetrated in the rural India. When we started our, concept of Desh Clinic, the first question was whether we can actually reach out to the patient over the internet or not. And to our surprise that, we have clinics very, very far, in very, very remote areas. But still, thanks to, Airtel, Jio and Bharat, broadband, we are able to, provide the digital, support or digital health to the rural villages. Yes, adoption is slightly difficult for us at this moment because it is not only the technology, it is the comfort of the patient, which is equally important. The patient should also feel that, I'm talking to somebody who is unknown to me. So here, the other parts comes in, but I'll not get into that. Maybe later, I'll talk about that, how the context becomes important, how the people become important, how the culture and the society becomes important in providing the digital healthcare. But these are my thoughts about the technology part.
So, thank you, Mr. Sharma. So next I'll move to Dr. Raja Indana. Dr. Raja, please tell us what have been your experiences during the pandemic, related to the digital, accelerating this digital adoption, and how we can implement these experiences in the future. Over to you.
Yeah. I would say it's a big thank you to how the system developed even before COVID hit. Thankfully, because of the system that is in place, quite a few patients who were not able to reach any doctor were able to understand that there are digital services where they can reach out to a doctor through a phone or through a laptop, and this made things much more better. Because in a country like India, where we have seen the first wave and second wave hitting very hard, and people were not having any view about how they can reach out to a doctor, because doctors were also not very open to meet at that point of time. Thankfully, the digital healthcare space, which was developing in that period, was able to provide that kind of services for patients so that they at least have somebody where they can reach out to. I would say it might have been on WhatsApp, or it might have been on any other medium through apps or wherever it is. But thanks to the evolution of technology, where at least a video call, at least an audio call and report sharing, these were able because of the internet and because of the network that is already developed within India. So this has accelerated people to understand about their health better. I would say that we have cases where SpO2, where saturation was such a medical thing, oxygen saturation. But now you go to a grandmother, she also knows what is SpO2. I mean, not putting them down, but who don't know how to use a phone, also they know what is saturation, what is heart rate, what is CT score, right? I mean, just step back to 6 months or 1 year, we have seen that the health understanding of people has gone exponentially high. People who didn't know about vitamins and minerals, people who didn't know about saltwater gargles, right? I mean, there was an exponential understanding about health as such. And thanks to how technology has changed so many things, and how pulse oximeters have become very common, reaching out to the doctors has become easier when compared to how it used to be 5-6 years back. So I would say that COVID-19 has accelerated the acceptance of technology, both from the doctor's side and also from the patient side. The patient's understanding of health has increased. The doctor's understanding about health tech has increased exponentially. I see that the ecosystem has grown so much that this digital evolution is going to go miles going forward. And thanks to how the government also has come up with, like how Mr. Ajay has stated, that how the government has come up with guidelines so that there is a structure. I mean, we at MFine, we have started way before these guidelines were even given for the public, but we were way within the guidelines even before these guidelines were there. So that made us comfort that, okay, we are on the right track. So India is going to see a big digital revolution. So yeah, I would say that. And the other thing I want to add is this: it is not always about just the medical care. Patients were looking for, can I talk to a doctor so that they can get a comfort that, okay, they are okay. They need that comfort, right? People were going all over the place, not knowing whether they are being okay, when to reach out to a hospital, when to get a CT scan. All these things, because of the convenience of health tech space, has created them to reach out to doctors much easily when compared to what it was before COVID. Yeah.
Thank you, Dr. Raja, for explaining it beautifully. I'll go next to Mr. Himanshu Sikka. And sir, please tell us What are your experiences during the COVID-19 pandemic, especially related to digital technology, adoption in healthcare?
Yeah, no, thanks. And picking up from where Dr. Raja left, I personally feel that it was little less of digital adoption, but more of a digital compulsion that forced people and brought them on WhatsApp calls or platforms like MFine, Apollo 24/7, etc., to get the first connect with the doctors. I personally feel that still most of the calls were happening on the normal telephones or WhatsApp calls rather than people shifting to the platforms that were available. Many people did shift to those platforms as well, not discounting that. But going forward, I think so the challenge remains that how we can capitalize on that momentum. I kind of sometimes compare it to the demonetization and the push towards digital money that happened post that. Uh, Things like Paytm was there before that, but not that active. Many of the other companies, be it Bharat Pay, Phone Pay, etc., were all born after the demonetization age. But today, if you see the transactions that happen through digital platforms are much more higher than what even during the demonetization time happened. So that industry was able to capitalize on that momentum or the initial push that demonetization provided and has built upon that. Can healthcare replicate that kind of a model is only time will tell. But I will just try to focus at where the challenge comes when you're talking about teleconsultation specifically, because we kind of keep narrowing down to teleconsultation when we are talking about digital health. So from that perspective, where telehealth is useful is in terms of follow-up calls, what Dr. Raja mentioned, comfort calls. But when it comes to first-time testing or first-time reaching out to a doctor, currently we are not at a level where the doctor can get a comfort or the patient can get a comfort that the diagnosis is happening properly. We don't have platforms which can provide even basic data like the BP or the temperature or the pulse rate or the SpO2 to the doctor. We are depending upon the patient to possibly use different gadgets and provide this information to the doctor. Plus, as well, the physical touch examination that doctors do, and patient also feels better about that, is totally missing right now from the tele consultation side of it. And that's where what Dr. Ajay mentioned earlier about assistive teleconsultation possibly comes in a play. Okay, you don't have a specialist doctor sitting with the patient, but even a person who is qualified or a qualified nurse with the patient who can monitor these things and provide. So that kind of can bring the rural parts of the country where you don't have a doctor presence, it can be useful for them. But if you're talking about an urban setting where you can find a doctor easily close by in today's time, there will be always a tendency to go and meet the doctor physically rather than depending upon the telemedicine. And yeah, of course, for follow-up calls and all, even to specialists, sometimes it's only a call over the phone is good enough. You don't need to travel for that. So we need to kind of distinguish there and try to focus our energies to provide or reach out to areas where doctor's presence is not there. That's our tier 2, tier 3 towns, rural areas, and focus our energies towards using telemedicine in those settings, and maybe through assistive models that Ajay mentioned earlier. And when it comes to urban settings and all, focus more on things which possibly are follow-up calls, non-emergency situations, comfort calls for the elderly, where they just want to know and have somebody to talk to and have a good feel-good factor. Okay, everything is fine. So if we focus, in my view, in these two directions, then of course telehealth has a huge potential. But if we kind of try to see that, okay, it's going to replace your first touch point with a doctor, whether it's an emergency situation or even in a general checkup, that I feel is we are trying to go in a kind of a difficult terrain, and where we may not be successful to the extent till we have point of care devices to a level which can help doctors sitting anywhere get information about you. There is work going on in that direction. There are RPPG based technologies which, like I'm talking to you right now, using just light falling on my body, it can tell the doctor about my heart rate variability. And but those are in early days of development right now. I think it will take a couple of years for those technologies to mature. So that's where I think we need to kind of use the COVID momentum that has been created, but kind of channel the energies towards where it would matter most.
So thank you, Mr. Sikka. And so how many years do you think it will take for us to reach that level? We are still in the experimental, phase. So this is a supplementary question to
Yeah.
my earlier one.
So see, the parts that I said where the doctor is not present, there of course, if we put the energies right now itself, the opportunity is there. Their demand is there, and that's not going to take too much of a time and effort to get that going. When it comes to follow-up calls and all, again, it is right now also happening, and it can kind of expand like anything. But when it comes to the first call to a doctor, unless or until it's an emergency situation like COVID-19, where you don't have any access, I don't feel that we, in the next couple of years at least, will be at a level where our wearables or technologies like RPPG can provide the comfort to the doctor or to the patient that the diagnosis is proper. If you're, let's say, late night, 11 o'clock, you want to consult somebody for emergency, rather than rushing to an emergency room, you could use a teleconsultation and then decide based on that that whether you need to rush to the emergency or not. But not for your chronic ailments and all. You will need to make that physical visit to the doctor and get checked up.
Thank you, sir. And I'll move next to the point which is very important, but of course related to
Mr. Enba, he did not share his views on this question.
Yeah. I was asking him a question which is related to it. That is, use of digital technology to strengthen patient-doctor relationship, which especially has happened in this, pandemic situation. So that was my question to, Anba, that please tell us that how has it, sort of strengthened this relationship between doctor and patient, especially during this pandemic scenario.
Sure. Well, I'll quickly add a context there, right? So, in the conventional healthcare, due to various challenges that we might generally see, right? The majority of the interaction between patient and the doctor happens in the consulting room in the conventional sense, right? I'm sitting here, the doctor sitting in front of me, doing assessing my symptoms, eliciting information, triaging, and figuring out the diagnosis or a potential diagnosis or a probable diagnosis, and planning with me a course of treatment and sharing with me. But most of the times, right, this interaction happens for a 5-minute, 2-minute, 10-minute window, depending on the the number of patients waiting in queue, or depending on the nature of illness, etc. So that's mostly where those doctor-patient relationship ends, right, or the interaction ends, I would say, in the conventional sense. Whereas once I walk out of the prescription, especially in a primary healthcare setup, is very rarely I have a feedback loop, right? It's very important in primary healthcare for the doctors or the clinics or the healthcare institutions, be it hospitals, to know what happened to this course of treatment. As many times the primary healthcare treatment, we don't always do testing to accurately predict the diagnosis and give prescription, right? There is usually a first course of treatment, and then there is a follow-on course of treatment based on the results. These are actually very hard to achieve in the non-digital world, right? A doctor cannot chase a patient, or the healthcare ecosystem is tough to keep track of what the patient does after they leave. Did they take the medicines suggested, or the course of intervention, is it even being followed? And we all do this, right? We may be working in healthcare, but many a times we may skip taking a dose of medicine done, or the moment the symptoms go away, we stop taking the medication, saying, hey, or due to any other issues, right, where people may not necessarily follow the full course of treatment. With digital means, definitely there can be a better connect, higher connect, both for the doctors, it's helpful, and for the patients to continue this relationship. Himanshu mentioned about follow-ups and post interactions, which are very small percentage of interactions today in the offline world, which can largely be taken over through digital means. So definitely it'll improve clinical outcomes. Having tighter feedback loops even is definitely one big part where digital technology is helping. Second, even in the COVID scenario, right, we constantly maybe not think too much about it. What to give a quick scenario, what prompted me to start up in the digital healthcare space when I was right in college time, way back in 2012, is the fact that there were simple communication tools existing at that time. I'm from the electronics and communication background, and we built a lot of communication tools and the impact it has created in the world, right? Like everybody has a mobile phone. This could even be a simple phone call, right? Today, probably 80% of the population plus are a phone call away at any point of time. And of course, with digital, there can be richer conversations and communication channels existing today. And one of the wide adoptions of WhatsApp was also what triggered us to understand, hey, how is that a simple communication tool like WhatsApp doesn't exist for the healthcare ecosystem, and that what prompted us to start up and grow and scale MediBuddy. Over the last 6 years, we have probably done 5 to 8 million online consultations through our platforms, and that's a rich amount of information for us to gain confidence on the kind of treatments that work online, kind of illnesses or issues that can be addressed, what can be in the follow-up space, what can be in the preventive space, what can be in the triaging space, and so on. It has only given me more and more confidence, right? Even during pandemic, both on the consumer or the patient facing side, as well as on the healthcare provider side, there was all these communication tools definitely helped. We may everybody knew awareness. We talked about how everybody knew about SpO2 and what is a good range, bad range, versus continuously emerging treatment protocols, right? Every other week or every month or so, there are ever changing treatment protocols. In historically, it would have been very difficult to communicate this to all the healthcare providers in one shot, whereas through digital channels, through social media, through various tools, internet that got adopted, both on the consumer side as well as on the healthcare provider side, definitely had made a big impact. It just looks like an undercurrent, but if COVID had happened 50 years ago, 25 years ago, definitely the dissemination of information wouldn't have been this fast. And always more information is good because it enables timely decision making and well-informed decision making across the ecosystem. So the digital technology definitely has made patient and doctor relationship as well as the healthcare ecosystems journey also to be much better, smoother the last few years.
So Enba, is there a section of patients who are still skeptical about these digital consultations, and do you come across such patients?
Sure. When we study about the technology adoption, right, there is always this adoption curve that we typically talk about: early adopters, early majority, late adopters. This is a standard innovation curve that we typically study in management or in engineering schools. What I would say is everything has to go through that curve. So there is no easy answer to it. But what is the time period can be compressed, right? Like black swan events like demonetization, for example, or however unfortunate during pandemic, maybe COVID as such a similar event for healthcare, definitely would have accelerated timeline, especially in the early adopters of the early majority side of things, for sure. Second, for healthcare ecosystem, it was equally important for the healthcare provider ecosystem to be also adopt these things. It's not always consumer driven. If a set of users want, but if no doctor is using a digital platform, then probably that would fail, correct? So this has probably helped both to start increasing at a rapid pace. So no doctor is probably only started 7 years back. We had to train every single doctor on how to use the app, how to digitally prescribe in the application, and it was a very uphill task in the initial year or so when we started out on our teleconsultation journey. And whereas we now have a large queue of doctors, in fact, who are keen on onboarding onto MediBuddy, that naturally shows there's been a big shift in terms of people more comfortable with digital tools ecosystems on the doctor side. This also extends to hospitals, diagnostic centers, paramedics, and phlebotomists, like the whole host of healthcare ecosystem has definitely adopted or been more aware of digital tools and solutions, and that as a means to reach and help more and more patients, for sure.
Correct. Thank you, Anba. And my next question would be again to Mr. Sharma, and it is on a very important aspect, that is electronic medical record. How relevant it is in in hospital settings. The relevance of digital. So what are your thoughts on this particular aspect of digital healthcare? You'll have to unmute yourself.
Yeah, I'm sorry. From the need point of view, yes, there is a need that, that we need to maintain the electronic medical record. But from the technology angle and from the data security angle, I think we are yet to, reach that level where the data is, secured. Government has also issued, that Aadhaar number is there, that one single number, you can actually fetch any data from, about yourself from anywhere, and you need to give consent also. In fact, there is a comment in the chat also that, that how do we manage the patient data when the person is talking to the doctor in the presence of the health worker there. So, electronic medical record, it is a necessity today, not because that, we just want to collect some data, but also that, there is a pattern of disease we can actually find out later on. There are a lot of other data also coming from the states, since we deal with rural, so we try to find out that what are the other things also happening. For example, soil clinics is giving the data about the soil condition, climate condition is coming. Later on, if you want to understand the epidemiology of any disease or anything, there is a lot of data which can be actually worked together and create some meaningful output out of it. But yes, the importance comes when it comes to the systems which will protect the data. ISO 27001, which is a mandatory thing now that most of the healthcare providers should have, so that it is done in the right manner. There are other certifications which are coming, but I don't see that all the companies are trying to take care of that at this moment. There are small companies also, companies like MFine, MediBuddy are the big ones. They would have already secured before even the law asks for it. But there are other small platforms which are coming in, and people are coming out with so many platforms now. When it comes to our setup, we actually we have sensitized our health worker that you are bound by the confidentiality clause that you should not reveal anything out. We also ask our doctors, also those who are there, that please ask that you are taking help of somebody else, and you're okay with that when you're taking the consultation. But these are the soft part of it. The hard part is we need strong system, because it's a person's privacy, topmost privacy we are talking about. So I'll say that the road is still long, and we have to pass through this journey of creating a safe electronic medical record.
Thank you, Mr. Sharma. Dr. Raja, I'd like to know from you that since automated patient history has a lot of benefits. So will the EMR help us reduce medical errors? In the future.
Yeah. So this is a very important question, because right now there is a lot of digitalization happening in the hospitals. But if we see, if it is only scanning a prescription or copying whatever is there, which is handwritten by doctors, I don't think it will be as useful as a medical record that is coming as a digital record. Which is typed and which is kept in a certain format. So if it is only a scanned copy, there are lab OCRs which are supposed to come in place, which can read what is written, and reading a handwritten prescription is not easy. So the adoption of technology in taking the data in a certain way. So that's what newest technology companies like what MFine, MediBuddy, and other companies which are looking into how they capture the medical data in a way that it is properly read in a digital format. So this helps in prediction of diseases. So let's say we actually can see that there are diseases like certain skin diseases where we have understood that it is predicted to certain locations of India. That can be attributed to the climatic conditions, or the genetic type that people are there in those locations. So there are diseases like lifestyle diseases like diabetes or hypertension, specifically increased in certain urban areas and certain locations, I would say like in the Godavari districts of Andhra Pradesh, where people take consultations here, and we see high number of diabetes from these places. This could be attributed to the kind of food they eat, rice consumption, and the genetic conditions. All these predictions are happening because we see the capture of data in the new age technology companies is in a certain format where it is better readable and easily. I mean, you can make data driven research or data driven approach towards diseases, right? Predictions can be better. Hospitals are also adopting, obviously, to say that MFine is bound with, I mean, it is, we have taken certification, ISO certification. We are very compliant to ISO certification and data privacy and HIPAA compliance, like how other hospital data also is following it. But collecting a data in a format like this would be much more beneficial in predicting the future. So, and the portability of this data. So what Ayushman Bharat mission is planning to do, how portability of this data has to be in a readable format, in an easy format. If this format is not applied at the hospitals and it is only copied as scanned copies, I don't know whether the future doctor who is going to see the document of the patient will be having that much of time to go through the topic or the scanned copy to make medical decisions in an easy way. So if whatever the data is coming, if it has to be interportable and it has to be in a way that the systems in the background, the AI can understand it and give it in an easy readable format where the time consumption is very less by the doctor who is seeing it in the future. So yeah, as Mr. Ajay said, it's a long way, and we hope that this adoption of technology happens at least all the major hospitals, so that whatever data is coming and whatever the data privacy rules are coming and interportability is coming, it would be helpful for better outcomes.
Thank you, Dr. Raja. I'm putting one question out of what the thoughts you have shared. So how much technological advancement is there in EMR, so that the interoperability has also I mean gets into it. I mean, do we have that kind of technologies in India? Do we innovate such technologies in India, or we get it from other countries?
I feel that India is far ahead in this part. At least I can ask Enba also to comment on this, because I know I have colleagues who are in the US and UK, and medical records there, because they have loads and loads of medical records which are paper based and which are all scanned copies, which are stored in I mean terabytes of cloud spaces. But the capturing of data, how it is happening in India, is happening because through a digital platform. It could be in the hospitals, it could be on teleconsultation apps, or it could be multiple other sources. But we are starting with this kind of start. So I would feel that we are well equipped in collecting the data and providing it into that interportable area. Yeah.
So thank you, Dr. Raja. Mr. Sharma, you want to add something?
Yeah. In terms of technology, yes, we can progress very fast. But I think in terms of adoption, what Enba said, that, from the caregiver side, I think the doctors need to also adopt that, they are comfortable with writing the prescription in the EMR mode. They still prefer that, okay, we'll write and scan and put it on the system. So I think that is one of the soft skill which we have identified, that we need to tell our doctors who are our empaneled doctors that please, it is not just writing something and giving it. It is that you're creating a record which will be useful later. So the farsightedness is very important in this.
Thank you, sir. And Enba, please enlighten us on your thoughts on how EMR is transforming I mean healthcare, especially in hospital settings.
Sure. While we don't build EMRs, we do work with a lot of hospitals and integrate with the EMRs of hospital labs, LMS systems, and others as part of our journey at MediBuddy. Yeah, hospitals. See, again, the initial most of the software that is used in a hospital environment starts with billing and ensuring it runs the daily operations and administration, as much as them being used for EMR. That's how it was probably 10 years ago. But it's increasingly changing, so increasingly getting modified, and hopefully with the right government push, there can be better adoption of tools and technologies. There's always a challenge, right? Even in the advanced markets, be it in the US, UK, a lot of push came through government regulation, right? Because if you think in the short-term way that most providers would think, it's an overhead, right? I have to do extra time. For me, it takes 2 seconds to write a prescription on paper versus me typing on a keyboard takes longer, which is where again innovation should come in, right? If it can be made faster to write on a laptop or a mobile phone than even writing a prescription, and if it can drive adoption, then that's an area that we should work on. So technology has both jobs, right? Not just to create the platform, but also drive adoption, understand user experience, build better UIs, build maybe incentive models, build create instant gratification, gamification. A lot of this has been solved in the consumer world, but a similar thing needs to be done definitely for driving any new tech and adoption. And of course, financial incentives would make sense. Finally, even healthcare institutions have to run in a, nobody wants to necessarily not do it, but it's the overheads of resources, right? Be it time based, be it resource based, or it could be awareness, or it could be the learning deficiency or gap in terms of me having to put an extra effort to figure out a new platform. So if we are able to solve each of these areas, then it can definitely drive adoption. We have definitely leapfrogged in many other industries. Potentially we have an opportunity to do that in EMR also. In the space, probably the ABDM's initiatives or the health ID initiatives is a good first step towards it, although it's early days. Definitely it can only get better from here. And of course, software, we're a software capital of the world, right? So there's no talent or the skill sets to solve it. We're probably also the medical transcription of the world as well. So there's definitely no dearth of ways and means to execute it. It's about people picking up the right opportunities, driving and getting rid of these access barriers or adoption barriers. It will definitely make EMR much better going forward.
Thank you, Enba. I'll next move to Mr. Sikka. The question is same. What are your thoughts on the relevance of EMR, and will also the incentivization, help in its adoption in the longer run?
Yeah, thanks, Rahul. And a lot has already been said on this particular subject. But from if you're looking at EMR, one has to also see the use perspective. One use case which Dr. Raja said that it can help in prediction going forward at what's going to be the disease pattern in a particular geography or a particular individual. There is a big issue of consent before you start using information for that kind of a purpose. And I don't think so we have those kind of consent mechanisms right now in the country like India to use data collected at a hospital to, unless expressly one is taking a consent for that. But the concept of EMR did not start with just that aspect or that research angle to it, or being able to predict what's going to happen in the future, but also to make correct clinical decision based on the past history of the patient. Now, gone are the days when you used to have a general practitioner or a family doctor for every family who would kind of know your disease pattern from your childhood, who would know what kind of ailments your parents or your extended family has, and would be able to kind of give you a good direction in terms of what your current diagnosis may be, just because he knows the family tree history. That is non-present right now. So today is a time when you end up going straight away to a specialist. You feel a chest pain without realizing that it could be an episode of acidity. You go and meet a cardiologist. Now, when you go and meet a specialist, the specialist needs to know what is the history of your ailments, whether you have had diabetes, for how long you have had diabetes, has that kind of fluctuated over the years, what kind of medication you have been on, similarly hypertension, since when you have been running high blood pressure, low blood pressure, again, whether there have been fluctuation episodes and all. So all that you need to know, whether you have had some kind of surgeries in the past which could kind of impact your current ailment, and that in most cases you will find missing, or people just conveying, or the patient just conveying parts of the history, which can lead to a wrong diagnosis. So that's where the EMR becomes useful. But unfortunately, in a country like India, we don't stick to a single hospital or a single diagnostic lab or a single doctor. So our data is all over spread across, and that's where the Ayushman Bharat digital mission is trying to kind of come in and create a kind of a digi locker for your health records, which can be pulled up together as and when required. However, what's missing in this entire thing is that not every data needs to be stored, or not every data needs to be stored for a full duration. It's not that the ailment that I had as a 5-year-old has any relevance today. Yeah, if I had a operation as a 5-year-old, if I had my appendix removed as a 5-year-old, that has a relevance, but nothing beyond that. If I had a fever episode or something, so that again, unfortunately, today, if you look at EMRs, that how whichever hospitals are maintaining it, they are not screening that information, and that's what happens is that you keep adding terabytes to terabytes of data, and soon you realize that if I have to manage records of all my patients, it's a huge cost factor for me, and that's where the problem comes, that most hospitals shy away from adopting EMR records in a proper manner. So there needs to be uh, one needs to kind of closely look at the clinician's perspective and see what information they would be looking at when it comes to a particular patient. If he or she comes for an ailment, what information is not required. Diagnostic test, simple diagnostic tests that I got done maybe 2 years back have no relevance today. No doctor would even want to see them unless it is for a specific disease or something very, very specific that he may want to see a trend on. So again, the issue there comes is that how we are approaching EMR. We are approaching EMR from the solution perspective. We, as Emba said, we have beautiful software and hardware engineers in the country. So they come in, they design these EMR kind of systems, and we take the solution and we implement in hospitals without kind of incorporating the clinician's perspective into it as much as it should have been. And that's where it becomes an unviable proposition for most of the major hospitals to manage and run EMR system. Even the biggest of the chains in the country today don't have good EMR systems. And I think so it's high time that we take the clinician's perspective, store the bare minimum that is required over the years, and then look at interoperability with labs or with across the hospitals. Let's first get the unit economics of it right, because otherwise, whatever incentives we may give, it will always be a cost center for a hospital, and they will always shy away from implementing it. We talk about Western countries. Even if you look at NHS, which is kind of seen as a best public health system globally, it's not compulsory for all NHS hospitals to maintain their records electronically because of the fact that it's a costly affair. So majority of the NHS hospitals, barring the ones in bigger cities, still operate on paper records. Of course, they have very strong paper record systems, so you can take out the patient file at any time, but they only store the relevant information in that patient records and not the entire history. So that's kind of, I think, so if you have to move in that direction, make it a good EMR for the country, we will need to look at these couple of issues going forward.
Thank you, Mr. Sikka, for such insightful view. My next question would be to Mr. Ajay Sharma, and it is somehow related to the EMR itself. That is patient data protection. One aspect is EMR. Then, as other speakers have pointed out during the course of discussion, that there are variables where we enter a lot of data, and there are a lot many other equipments where we have to somehow enter our data. So how can the patient data protection be done, and how prepared we are to deal with this mammoth data built up? So this question has also been controversial in nature, because a lot of activists have pointed out that data has been misused in some cases, So how true or untrue that question is, and how can we deal with this patient data protection issue? Over to you, Mr. Sharma.
Yeah, as we discussed in the last session also, or last question, patient data protection is a very, very important thing because it is the most private thing the person is revealing there. There are multiple aspects to it. One, when the person is revealing, the person should know that I am revealing and there is a threat, there is a chance that it may get leaked out. So the person has to be, told upfront that there is a possibility of data leak. So you have to be careful where you are, divulging the data. Second is using the technology. More and more wearable devices are coming, and when we use the cell phone, you don't know actually that data which you are covering, either through a smartwatch or maybe through a app which is giving you data, where it is going. We actually don't know. So there has to be a protection at that level also, that when the person is downloading that app or using that particular smart device, should know that where this data is going to go. We have become slaves of technology to that level that we just say accept, and we just say okay. So that's a second level thing. Third is when it comes to institutional level. So when you are in a clinic setting or when you are in a hospital setting, yes, there is a responsibility of that caregiver institution also, that we need to protect the data. But again, they have to tell the patient that we are collecting this data and will be uploading on the EMR. There is that the person should be cognizant about that, there is maybe a chance of leakage, although they will also ensure that we have taken care of using the system, processes, firewall, etc., so that there is no other person who can take care of this data, to access the data. The fourth part, which is the most important part, is when it comes to the cloud part of it. So you have done all the things, you have collected the data, everything, but then it is lying somewhere in the cloud. And with the the dark web which is there, they can do any damn thing. So there the security becomes even more tighter, which is required. So patient data, I must say that there is a susceptibility of leakage there. We have to ensure that at the time of revealing the information, at the time of collecting the information, and at the time of storing the information, all these three places, we need to create a protection system. But it is one of the threats in the digital healthcare.
You're on mute. You're on mute.
Yeah, I'm sorry. Thank you, Mr. Sharma. Over to Dr. Raja. Please share your thoughts on this particular subject of patient data protection.
Yeah. So as Mr. Ajay shared and also Mr. Sikka, a lot of times patients or consumers don't understand what they're accepting to also. So a lot of this information, like how it is going, people are accepting. They clearly don't know what is how this data is being used. As responsible companies, I think these initiatives have to come from within the system, and the providers understanding the part of this consent and using this whatever information that is provided by the patient and the de-identified data can be used for research. See, why is digital data or digital health data so important from the government perspective or healthcare providers perspective? If it is de-identified, it can do wonders in research. It can do wonders in predictions. The most important point is how is it de-identified? How this data is used? How are we keeping the privacy of the people who are providing the data? These are important aspects that we need to understand. And providers should be much more cognizant of the fact that, okay, the data is the patient's, and the patient is the sole proprietor of his health data. So that is the utmost important thing. And I think the regulations in India are way towards that. That's what we see. And whatever adoption is happening is towards that. Yeah. You're on mute, Mr. Rahul.
Sorry. Thank you, Dr. Raja. Same question to Enva how do you see patient data protection from your point of view and your company MediBuddy's point of view?
Sure. See, at MediBuddy, we have a very active team. So there is a investments constantly being done on the engineering side, on the compliance side, in terms of how we deal with data, both internally as well as the way we collect, the way we store. There are a lot of data classification practices as we collect more and more data, and we are as some of the panelists pointed out, while collecting all this data digitally helps, it also comes with the responsibility to actively protect it, both on the privacy side as well as on the security side of things. It is so we, for example, at MediBuddy, we probably go through 50 data security audits in a year from various customers that we work with. We work with large MNCs, ITS companies. So some of them, because we partner with them, they audit us on our best practices. We are ISO certified for the last 5+ years. So there are many standards that are available which we can proactively do it, even if it's not mandated by the governments yet. And there are, of course, emerging policies coming up. So at least at this moment, self-regulation is very, very important to adopt these standards or adopt these best practices. And it's not specific to healthcare, right? Data security across many other industries also is relevant, but particularly more important in healthcare, given the nature of data that healthcare organizations are getting in touch with, right? So while we make multiple attempts, there is a consumer side of the story also. So there, I think a lot more awareness is needed. What kind of data gets shared? What kind of today? There's always this saying, right? Don't lie to a doctor or a lawyer is a standard statement. So there is a lot of honesty and openness about the critical information that patients share, but protecting it is very, very critical in that sense. Again, we are again probably one of the best equipped in the world, since a lot of the software companies from India implement HIPAA, implement best security practices for the world, or there is a lot of engineers probably who are of Indian origin sitting in more advanced market solving these problems. The good thing about technology is that it is constantly improving and evolving, since the world a lot of open source has enabled that, which means keeping up to date with what's best available is also very, very important for organizations and healthcare providers in terms of upgrading their systems. Learning, constantly staying on top of things is very, very important. And but just like how most other technology elements have become commoditized or platformized, and today somebody doesn't need to understand how cloud servers infrastructure works, you can go and get an AWS or a Google Cloud. Similarly, security solutions also would start emerging, or privacy solutions will also definitely start emerging, which would mean that it'll be maybe not as complex as it is today, or probably a few years back on implementing these also. There is also a question on economics. Naturally, with more adoption and more newer systems emerging, hopefully those costs can also definitely will come down. So looking forward, there is a lot of I can see only improving trends in terms of adoption, but definitely awareness creation among the users, or finally the custodians of data, is also very, very important.
Thank you, Enba. Mr. Sikka, your views on patient data protection?
No, as everybody has said, patient data protection is quite a critical thing in today's time. And I think most of the Indian companies, at least in terms of following the standards, and whether it's Indian standards or European standards, do comply to those. There is no dearth of compliance, but still breaches do happen. So from when a breach is happening, one has to understand that what, as an individual patient, where is the risk? What is the risk that the patient faces if his or her data gets breached? So if it's if identifying markers are there in the data, then there are two kinds of risks that could be there. One is something where the person could get discriminated because of the disease that they have or the problem that they are having today. Or the second is from the economic side, that they may get targeted marketing pitches coming in from those pharma companies who are kind of dealing with that kind of an ailment. So these are the two challenges that a patient could face. Now, if you look at traditionally the Indian health system, forget the digital side. we have never taken data privacy seriously. If you have any one of you or any one of the speakers would have had any small heart surgery in the family where a stunt had to be put in, you go in your patient is in the OT getting an angiography done, and doctor has not yet told that there will be a stunt required, but there will be 4 MRs sitting outside targeting you, selling you the different stunts that they have, or their company stunts. Similarly, if you go to a diabetes, they will be selling you the insulin devices sitting outside without like. So data privacy has never been taken seriously in a country like India, and from that perspective, at least the companies today are making the system stronger, that the leaks don't happen. But I feel that it's more to do with the at the facility level itself, leave out the digital side, at the facility level itself, safeguarding the interests of the patient and making it much more protected from the leakage of their information. That would be the starting point. And then, of course, one can focus on that how can we make the digital system much more stronger than what the companies are right now also doing.
Sure. Thank you, Mr. Sikka. Now we come to another very important question, and that is the policy and regulatory framework for fast tracking digital. So we have recently seen that in the budget there has been allocation of whopping rupees 1,600 crore for creation of a shared public digital infrastructure. And in fact, many reports have estimated that in the next decade, NDHM can potentially unlock rupees 1.5 lakh crore for the healthcare industry. So where do we stand on the policy push and the regulatory framework so that we can fast track digital healthcare? Mr. Sharma, your point of view on this.
I think from a policy framework point of view, healthcare itself is the big area, but it's a state subject. So many times, we have this issue that whether it's the central responsibility or the state responsibility. 1, 2, from a digital side, we have for example, primary healthcare system, PHC is what we call. We have lots of PHCs in India and spread over across all the villages, or at least at the small town level. But they are not digitally enabled. They are still operating, at the base level. So when the eSanjeevani was launched, I was expecting that, that eSanjeevani will be clubbed with the primary healthcare centers, so that there is a adequate support given to those doctors or those enablers, ANM, GNM, people who can adopt this. So it is not only the policy framework at the digital level or at the NHM level or NDHM level. It is actually at the ground level, they need to think that, who are the beneficiaries and how they are going to get the benefit out of it. That part, we have seen missing. I have traveled in at least 4 or 5 states, at the village level. And these PHCs has become more of like, the community centers rather than the hospitals there. So digital part, very important. Club it with the physical part, create a hybrid system. We need that, for the time being, to provide the right healthcare at the rural level. I am talking more rural because that's my focus area. But we are trying that, and we in fact did talk to the state government, and we said that give us few physical PHCs. We will try to make it a hybrid one, so that at least people are taken care of. So that part is quite missing at this time. So digital per se is not important. Digital in the current physical structure is very important.
Sure. Thank you, Mr. Sharma. And next, Dr. Raja, please tell us, what should the policymakers do to fast track digital? Since we have very less time, I would request you to finish in 1 minute.
Yeah. So like how Mr. Sharma said, driving the adoption is more important than just the policy. So policies happen, but the adoption at the grassroots level, where the beneficiaries are from smaller places also, and from the entire part of India, all parts of India, which is more important. So adoption has to be much more stronger, which we see that there is better adoption from the consumer point of view. provider point of view, the adoption has to be much more stronger, keeping in mind that whatever the kind of transformation or the changes are happening have to be at the grassroots level also.
Thank you, Dr. Raja. And by your views on what government should do to push digital healthcare? Yeah.
No, I think in the past few years, definitely already the government is making significant advances and push. I mean, we may not again realize it. Probably Arogya Setu is probably the largest digital healthcare app in the country, right? Through which we are able to disseminate information, beat COVID. So it's not just regulation, but also by leading as an example. These are some of them were open source projects that were led by the government as well. So there are many good initiatives already coming through, and with NDHM created, it's also a large opportunity. Very excited for the future in terms of what regulation can bring, and it's very constructive, unlike most other economies which look at it in a restrictive way. This looking like a very positive steps that the government and policymakers and the bureaucrats are making, and definitely welcome and very excited for the future.
Absolutely.
Thank you, Enba. And I'll next move to Mr. Sikka. Mr. Sikka, recently, government has announced telemedicine guidelines, as well as they have launched National Digital Health ID in August 2020. And of course, there are a lot many other initiatives which are coming up. So, do you think these are enough to, build a very long-term sustainable digital healthcare ecosystem in India?
No, I think Rahul, things are evolving. Some of the things came by compulsion. So the telemedicine guidelines had been in the making for I think so 7 or 8 years. But as soon as the COVID first wave hit us, it became a more of a compulsion, and government within 15 days came up with a policy paper around it and the guidelines overall. Whether they are perfect, possibly not. There are still a lot of gray areas there, which doctors, if they read it line by line, get scared of. And need to be taken care of. And so government is working in kind of seeing that how it can be best suited to the current scenario as well. Things around NDHM, which everybody has talked, a beautiful health stack has been designed at the national level, and I think government has done the first step, and the first step has been in the right direction. Now, the second step is more about collaborating with the different stakeholders in this space. A simple example is, for insurance companies, if each and every hospital had a same format for discharge summary, as simple as that, that will solve a lot of problems for insurance companies. You will not have 10 TPA sitting in a hospital. It will solve a lot of things for the hospitals as well. So these are simple things that the government now is focusing on and needs to work further on. Different kind of data exchange servers need to be now designed and put in place, so that like you have the UPI, you need similar UPIs for different parts of the health stack that has been designed. And I think private sector will need to play a equally important role there, working closely with the government to see that the framework is getting implemented on the ground, because it's not just the national or the state government issue, it's more of a public and the private sector issue as well. 70 to 80% of healthcare in the country is delivered by private sector. And unless the private sector comes forward in that direction, it's going to be a challenging journey.
Thank you, Mr. Sikka. And now, last, but not the least, it's very important question, that is, the human resources part, without which, the sector won't move forward. And how do we prepare the digitally skilled workforce of future? That is the question. Mr. Sharma, your thoughts on this?
Yeah, I'll be brief. I think we require the training at multiple level. From the doctor's point of view, also, sorry to say, but not all the doctors are digitally, savvy. I'll not say digitally literate, but they are not savvy. So there is a need that they need to understand this. The second part is, since we operate at the assisted level and we are at the rural level, we found a major lack of human resources, trained human resources there, and they need not be as trained as the doctor, but they should be at least at the good paramedics. So the good paramedics which are digitally sound, they need to be we are developing our own training modules now, because we are not having that. Although there is a health health sector skill council is there, which is actually has good amount of training programs. But I don't know the efficacy of that. I don't have that data. But there is a good program. We have actually taken the inspiration from them and creating our own setup. So yes, the private players have to take initiative, go into this. The big companies, MediFine, MFine, MediBuddy. You have good resources to support the ecosystem.
Thank you, Mr. Sharma. Your thoughts, Dr. Raja. I mean, are we ready with our digitally skilled workforce for the future?
No, definitely not. I would say, coming from the doctor's point of view, also if I see the awareness of digital acceptance from doctors is also have to come from the medical college level itself. There should be having some fellowship programs, or let's say there can be some courses in the hospital pertaining to the digital health. See, we have been evolving in this space, and the new doctors who are coming out also need to be aware of the digital space and understand the concepts of digital health from their training areas. So maybe a couple of months during the internship, they can be posted. They can work with different organizations, let's say Desh Clinics, so that they will have these rural postings through the digital medium, and also can have fellowships from different engagements have to be thought through for the doctors itself, so that they are trained for the future going forward. And similarly, the workforce, if you see the way diagnostic industry is growing in India, there are more than 7 lakh home sample collections happening in India on a daily basis. So there is a severe dearth of, I would say, resources there. So these things can be thought through. See, preventive health is going to be much bigger because of the kind of population that we are. So we are being a diabetes capital, and 33% of Indian urban are hypertensive. So early detections, early interventions can make better outcomes. So considering all these, there would be need for high amount of force, manpower in these areas. So all this has to be thought through, and more for better outcomes have to be thought through, and policy changes have to happen, better education systems, so that all these are taken care of. Yeah.
Thank you, Dr. Raja. And by your quick views on this particular topic.
Yeah, sure. No, I think of it as two ways, right? There is also a lot of digital workers in the country. So the companies, the workforce who are already digitally savvy should learn probably the necessary elements of healthcare servicing and healthcare delivery. That is one aspect of training also that we actively do at MediBuddy, say be it at our call center, be it with our engineering team or product teams, because it is not only about the medical professionals. Both sides can come together and learn from each other, and vice versa, right? Like the medical professionals becoming digitally savvy. Of course, not all of the burden is on us. The world is changing digital, so be it from your e-commerce to travel to so all the training of the digital tools need not be necessarily with us. Everybody uses a Facebook, WhatsApp, TikTok, and there have been quite a few surprising elements, right? Like fresh doctors out of college, I've seen them use the mobile phone like crazy, right? Like prescription done in few seconds on the other side, while we are when we have observed some of these doctors use these digital techniques, because the world is changing, world is evolving, and doctors, medical professionals are definitely a core part of the community, and probably also relatively smarter and early set of folks who can in fact adopt these technologies little early. There could be, of course, awareness being created is definitely important. Second aspect of any digital adoption, even in the consumer ecosystem, is about building products with the right user experience in mind. So many times you can always build a lot of tech that actually solves problem. If nobody uses it, it doesn't make a difference. So building great user interfaces. So we at MediBuddy have doctors who are part of teams which are building mobile apps, doctors who are part of engineering teams, doctors who can code, and vice versa. And we actively recommend product managers and engineers to go to a hospital to understand what's happening on the ground, how people use the tool that an engineer or a product manager is building, because those initiatives definitely creates mutual empathy and mutual learning and accelerates it for sure. And world is definitely moving forward on the digital front. So we have that momentum behind us. We just need to use the best elements that worked in other industries and replicate the same for us.
Thank you, Anba, for your detailed response. And now I'll move to Mr. Sikka. Sir, please tell us that what should we do to build a digitally skilled workforce for future?
I don't think so. Building a digitally skilled workforce is an issue. We generally lack workforce in the healthcare space at different levels. That is a bigger issue. I think training them, once you have them trained in a particular skill set, training them further into digital skills is not going to take that longer, because as my previous speakers mentioned, most of them today are savvy with phones, with computers as well, have had some exposure to them. So it's not about, because see, ultimately majority of them, what will be they doing? They will be typing into the system. They're not using digital technology for anything beyond that. They're not writing AI algorithms. That's a totally different space where you need a totally different skill set. Majority of them are going to use it for typing, and teaching somebody to type on a computer system today is not a major issue. We as a healthcare industry need to focus more on training on technical skills. Very as simple as a nursing cadre, which is highly kind of missing in the country in many of the tier 2, tier 3 towns, especially phlebotogists, or be it your paramedics and clinical staff required at a facility level. We are missing, like the numbers are much less than what is required for a country like India. So I think we need to focus more on the general healthcare workforce skilling rather than just the digital side.
Thank you, Mr. Sikka. Since we have come to the fag end of this discussion, very fruitful discussion indeed, I would say. I would request you to take some questions. The first question from Mr. Suresh Babu Subramani is there any development happening in clinical communication, patient engagement areas? Who would like to take this question? Mr. Sharma?
What these bots become. No, jokes apart, but in terms of clinical communication, I think the focus is slowly coming into India. So way back in like 2 decades back, when I was studying in the UK, and I had a medical friend as well. So he used to tell that here we have to talk to a patient very politely before we even we have to take a permission before we even take a pulse of the patient. Whereas back in India, we would never think of asking the patient, and we'll just hold their hand and take their pulse and not even tell them about what ailment they are facing or what medication we are giving to them. So that change at least has come in the urban settings and in the larger hospital chains, that you get the doctor explain to you that what your ailment is, as well as tell you that what medication is being given and what kind of side effects it may have. So it's a slow journey. I think we have started moving in that direction, but largely speaking, I think it's a area that needs much more development.
Thank you, Mr. Sikka. Next question from Ritika Pandey is, how can digital health solve the problem of information asymmetry faced by patients? A lot of times the patients are aware the various low-cost alternatives available. How can technology play a role here? So, Ritika Pandey from IPE Global. So anybody would like to answer this question?
Quickly answer it. I think it's already happening, right? We could see a lot of people being active on social media, talking about many of these things. It may take its time to maybe reach till the last person on the country, but definitely see this already improving. People Googling for it, people sharing information over WhatsApps or various communication channels. There are a lot of YouTube videos. Of course, how to ensure the information is correct, accurate is a second problem with over availability of these information. But digital is definitely the key way to do it, because the kind of scale and reach that digital ecosystems, communication platforms can have probably has never existed at the scale ever before. So it's only improving. Low cost alternatives, I think it will automatically, with awareness, more information being put out in the market is definitely going to help. Second is it also needs to be through the medical profession. So in healthcare, a lot of the decision making is done by the doctors, and many doctors do, right? Like they understand the background of the individual and suggest the right solutions or alternatives. So there's a lot of responsibility on the medical community as well to be to work towards ensuring the overall cost of healthcare continues to stay low and doesn't increase, and propose all relevant options. So hence, with the right combination of the intent from the medical community and more information naturally being available on the ecosystem, be it social media or in the World Wide Web, definitely is going to improve only going forward.
Thank you, Anba. Next question is from Dipankar Datta. He's asking, are the digital technologies in India innovative, sustainable, and scalable enough? How do we measure their success?
Yes, maybe I will take this question. We see that there's a lot of technology innovation happening in India. So like Mr. Sikka said, that there is a PPG signal which is required to collect data about your vitals. So it can be a heart rate, it can be BP, it can be blood sugar also. So at MFine, we are working on that. Currently, we have launched SpO2, where on the phone, you can just put your finger on the flashlight and camera. It can tell you about your saturation, your heart rate, and your blood pressure. So glucose is on the way. It is under research, and it's going to come in a couple of months now. And all these are we see that it's 80 to 90% accurate. So what are we trying to do? We are not trying to replace the devices that are there. But if you see, more than 200, 300 million people are diabetic and pre-diabetic in India. And more than 33% urban people are hypertensive. So what if we could identify these people early and track them for better outcomes? So all these digital tools and collecting the data of patients in a very structured way, how the doctor needs it and which is helpful for him. All these will actually lead to better outcomes. That is what we feel. Yeah.
I think a lot of non-invasive diagnostic,
Yes.
development is also happening in India, and
Yes.
which is actually going to revolutionize. And with the focus on semicon coming to India, semiconductor coming to India, I think next 3-4 years, India will become a very, very formidable force in this area, medtech area.
Yes. And if we are more mobile centric, we see that the adoption would be much more higher than adding a new device. I know people, there are watches, Apple watches, Fitbits or MI bands, different devices are there. But if the technology can be mobile centric, the adoption can be way, way higher, multifold when compared to these devices.
Correct. And so Dr. Viswa Nadam Dupatla has put a question: in this digital world, how public and private players can include rural population who needs the most but have least access to? I think Mr. Sharma can probably answer that question.
Yeah, I did answer on live also. Yes, it is a very good question, and it is a very much needed, requirement at this moment. Public and the government, together with the private players. Private players alone cannot handle everything. There are a lot of things which are required. So it's a combination which is important. The government has done a very good job of creating the health infrastructure, at least from the policy perspective, at least from the resource perspective. In the implementation, there are issues. So private players can actually jump in, bring in the agility, efficiency, and the technology to make it a big success. And it is for sure that, when we started Desh Clinic, people asked us why you are going to rural area, because, digital is not the right. And I think we believed, as founders, that it is the rural area which requires the most, the digital healthcare. So we can contribute as a private player, but we need to work with the government and the public, sector.
Thank you, Mr. Sharma. There are a lot many other questions, but given the paucity of time, thank you so much for extending, your time and answering these questions. I'd like to, sum up today's discussion. Since there is a, significant need for digital technology, to bridge healthcare gaps, I would say in nutshell, digital healthcare is needed to improve access to healthcare, reduce healthcare efficiency, improve the quality of care, and of course provide individualized healthcare. So India holds the potential for digital healthcare growth. Given the kind of innovation rate and growing population and surging healthcare industry. So while India's dream of a digital health ecosystem, might appear to be an uphill task, but it certainly is important. And it's not that impossible to achieve this sort of a goal, the kind of acceleration we have seen in the COVID times. So what we need to do is to maintain this momentum going forward. So I'd like to thank all my esteemed panelists for their insightful views today. And ladies and gentlemen, as I come to the end of the discussion, I'd like to acknowledge the presence of all the delegates today. And I'd like to also thank the team BioVoice for working tirelessly to make this event happen today. Thank you once again to Mr. Ajay Sharma, co-founder, CEO, and operations head Desh Clinics, Dr. Raja Indana, medical director MFine, Mr. Enbasekar D, co-founder and CTO MediBuddy, Mr. Himanshu Sikka, project director SAMRIDH Blended Finance Facility. Thank you very much, esteemed panelists. So this is Rahul Koul. This is Rahul Koul signing off. Thank you and goodbye.
Bye-bye.
Thanks a lot. Thanks.
Bye-bye. Thank you.